Good afternoon, everyone, and welcome. This is Ruth Christopolsky, Senior Vice President of Population Health for Atrium Health, and I want to thank you for your time today. We know how busy each and every one of you are, and giving us an hour of your time this week, we are very grateful for. We're entering into the second phase of a back-to-work town hall that we started 2 weeks ago. The recording of that's available. If you would like it, please let us know and we'll make sure we get it to you. And today we're really excited. We have, I think, a very, very thoughtful and a deep discussion to have with you, as well as some solutions that we'd like to talk to you about as we begin to open up our communities and our workplaces and begin to think about what the next phase of how we're going to work is as we live in this COVID world. I have the distinct pleasure of having our esteemed colleague, Dr. Katie Passaretti, join us today. Dr. Passaretti is our medical director in infection prevention. She has been at the front line for Atrium Health from day one with COVID. She has led our teams, helped define the program for our 38,000 plus employees, and is very, very knowledgeable about COVID and the COVID response and how it impacts us in the workplace. And so I'm going to turn the stage over to Dr. Passaretti, and she's going to talk to you about a whole host of interesting topics around COVID, and then talk to you about how testing and other things play into our response from a COVID perspective. So Dr. Passaretti, can you take it away from there?
Sure can. Thank you so much for giving me this opportunity. So I'm going to be talking a little bit, just like all the businesses in the area are broaching topics of reentry and getting back to a new normal type of business atmosphere. Atrium Health has been doing the same. So talk about the guiding principles that we have taken to try to make our environment as safe as possible for our patients, as well as the many, many employees that work in our system. I'll just kind of preface the comments by saying, from the infectious disease and infection prevention side of things, there are 3 guiding principles that we try to keep in mind as we develop these protocols to keep patients and teammates safe in this era of COVID-19. Those 3 principles are: how do we minimize the number of people who come into contact with each other, given each contact increases the risk of potential exposure to COVID-19? Secondly, how do we build on existing personal and environmental hygiene recommendations to further enhance the safety of our workers in our community? And finally, how do we minimize the mixing of sick and well to protect those most at risk? So next slide, please. So at Atrium Health, we have developed a program to make our facilities as COVID safe as possible. So that's a multi-pronged intervention. So on the kind of interventions at the facility level, we've developed enhanced environmental cleaning protocols. We know both in the workplace and in the hospital environment that surfaces are prone to contamination, and the ones that are most prone to contamination are those touched most frequently by many people. So not only in the patient care area, but in the areas where our teammates congregate, places like break rooms, conference rooms, these are all areas where there's potential for contamination. So really working to identify any opportunities with enhancing environmental cleaning is important in the areas, and thinking about those extra areas where people tend to spend a good chunk of their time during meal times, break times, is always important. Social distancing is probably the hardest thing for us as human beings to accomplish. We're all very social individuals and tend to have a lot of touching and being in close proximity to other people. So how do we work on that in the workplace? We've developed a set of cues to really encourage people to maintain 6 feet or more in waiting rooms, check-in lines, and other areas where patients may be congregating, and also working with our teammates to readjust schedules and readjust the layout of common areas to try to encourage that 6-foot distance where individuals are most at risk for spreading COVID from one to another. We've also worked on text message notification, so patients aren't waiting in waiting rooms together with other individuals for a prolonged period of time, and utilizing electronic tools for check-in. To the point of minimizing the mixing of sick and well, it's important to identify individuals who are sick as they're coming into the facility to the extent possible. So we've put in a number of protocols to do both temperature checking and COVID symptom screening upon arrival. And that applies to patients, visitors, staff, vendors, really everyone coming through our doors, to make sure that if anyone has a fever, has symptoms of COVID, that they're not coming into the common areas of the hospital and instead redirected. We are going to continue visitor restrictions in these early days of the reopening, again, with that mindset to try to minimize the number of people in the facility to those that really need to be there. Next slide, please. Hand in hand with the measures I just mentioned are hand hygiene. So, you know, it's an oldie but a goodie. Hand hygiene is the #1 thing we can do in any setting to prevent the spread of infection. So making sure our areas are set up with adequate hand hygiene supply, reinvigorating hand hygiene education and protocols is a key component in any setting. In addition, personal protective equipment can be an effective tool. I think, as most are aware, masks are now recommended in settings where there's groupings of people. So for individuals outside of our hospital setting, patients, visitors, we recommend cloth masks from home if they have it, or if not, we provide a mask when they're in our setting so that we can protect other visitors and our healthcare workers. Finally, I'd be a little bit remiss if I didn't talk about the care of the COVID-specific patient. So we've developed a number of protocols if a patient is identified as having COVID to make sure they get excellent follow-up. And in many cases, that can be done from the comfort of their home. So this has a number of benefits. It works toward that goal of minimizing mixing of people that are known COVID positive with those that are, you know, asymptomatic and not and healthy, to try to prevent transmission. And it also is a very convenient way to get care for our patients. The patients get a monitoring kit that includes a blood pressure cuff, oxygen monitor that's brought to their home. And then, you know, it's really easy access to clinical care that's appropriate for the needs they have at that time. It also allows us to leverage our virtual workforce that can work from other sites and minimize the number of teammates we have in site. Similar to other businesses, as much as, you know, we can keep virtual, I believe it's important to do so, really to minimize the number of people in a group setting. Next slide, please. So I'm going to switch gears and just talk about testing in particular. So the stuff I mentioned before is all aimed really at the infection prevention side of things. How do we accomplish those 3 goals that I had mentioned to start off with? Testing does play a role. I will say that, you know, the situation with COVID in general is rapidly changing, and we're having to evolve our approach as we learn more. Currently, with regards to testing, the types of testing that are available, there are diagnostic tests, which in general are tests called PCR or polymerase chain reaction tests. These are deep nasal swabs that identify whether or not the person being tested has active infection, whether that's symptomatic or asymptomatic with COVID-19. The other type of testing that people are hearing about in the news is serologic or antibody testing. These tests are intended to find antibodies indicating whether or not the individual potentially is immune. So whether they have been previously exposed and subsequently have developed an immune response to that. I will say just a couple of caveats because there's a lot of information out there that can be overwhelming. There are many, many products for serologic testing that are out there on the market, and you know, a number of them have variable performance. So just be careful when you're looking at different testing platforms that, you know, you've been given the knowledge to understand the results that come from it. These serologic tests are not really intended for diagnosis. Antibodies take anywhere from 7 to 14 and sometimes longer days after infection to show up. So, you know, there's a gap there, obviously, that would miss acute infection. As far as it relates to immunity, we're still very much learning about the duration of immunity after COVID infection. So while if I have a positive antibody test, I may be immune at that point in time, we're still learning whether that means I will have long-term immunity. Does that immunity mean I'm good for a month, a year, 10 years? We're still too early in this COVID journey to know that completely. So I would, we're just making sure that as a medical community, we're ensuring people understand how to interpret their results and what it does and does not mean. As far as COVID testing at Atrium Health, we have been extremely lucky. Our molecular pathologists in our lab worked very hard to bring testing into our own lab so that we were not reliant on commercial labs. So just to go through a little bit of a timeline, on March 3rd, the first case of COVID-19 was diagnosed in North Carolina. By March 11th, our lab had developed an in-house laboratory test based on WHO methodology and had it up and running for our patients. By late March, Atrium Health was one of 30 hospitals and commercial labs who implemented the Roche Cobas 8800 COVID test, which allowed significant expansion of our test capacity. And then in late April, the lab added an additional COVID-19 PCR platform to further expand testing capacity. The benefits of this to our patients and our teammates have been vast. It has allowed us to do access to testing much earlier than elsewhere in the state and country. We were able to broaden testing criteria much earlier than others, and it has allowed us a very rapid turnaround time. So our PCR tests come back within 24 hours and most commonly less than 12 hours. So our patients have a result very quickly and know whether, what next steps are. So that's been a huge benefit. With regards to serologic testing, so that antibody or immunity test, we are also bringing this into our core lab so that we have capacity in-house to perform testing for our patients, healthcare workers, and partners. There are several different types of antibody testing that were out there. We're bringing in-house 2 different platforms, again, to make sure we have adequate capacity to meet the needs of our patients and community. And currently our capacity is will be around 2,500 to 4,000 tests per day, as long as we have enough supplies to keep running those tests from central distribution. So just a couple words on facing the future of COVID-19. I think it's widely recognized now that we're in this for a while. It's going to be a marathon rather than a sprint, and flexibility is key. At Atrium, we're committed to reviewing the data as far as trends in the community and hospital and pivoting approach as needed, as well as making sure we're using different tools like laboratory tests to benefit our community, and that we're providing not only testing capacity, but knowledge base to know how to use those tests most effectively. And the other thing I just emphasize, both in our facilities and within businesses in general, it's a confusing time for everyone. So, the need to communicate regularly and clearly with our employees, with our community, I think is going to be essential for a while to come. Thank you very much.
Thank you, Dr. Passaretti. That was very, very helpful. We appreciate your leadership and expertise. I do want to encourage the individuals that are joining us today. If you have questions for Dr. Passaretti or for any of the presenters, if you type them into the chat box in the live presentation, the teams on the Atrium side will actually be sending those out to the presenters, in some cases live while we're still on. And in other cases, if we can't get to your questions, we are responding to all of those questions and then sending them out to all of the attendees at the end of the presentation. So we'd like to encourage you to please ask questions if you have them. I've had the unique pleasure to talking to many of our employer partners over the last 6 weeks or so, really trying to understand how to meet your needs as you're beginning to think about the community opening up and either re-entry or greater re-entry into the workforce for your teammates. We understand that being your partner is really important. We want to be a trusted solution for the employers in the region, and that's a huge responsibility, and one that I want to let you know that we're trying to embrace, engage in. As far as that, my number one comments to my teams are, we're always going to be transparent. And so the environment, as Dr. Passaretti stated, is changing really rapidly. The symptoms of COVID, we learn more every day. The presentation of COVID, the complexity of the disease by patient type, whether it's age or comorbidity related, is we're constantly learning. And so this ever-changing, fast-moving environment is hard for us to navigate. So we're pretty sure it's probably as difficult for all of you also. And so we're really trying to build processes and capabilities to work alongside you, and that's scalable, but also flexible enough to change as the information that we receive changes. So know that everything that we do, we're doing with the thought process in mind that the rules of the game may change tomorrow. In addition to that, we're trying really hard to make information available to everyone and as up to date as possible. We are a collective community when it comes to addressing COVID-19, and this is a team sport, and we're either going to all succeed or fail together. And so we're trying really hard to make sure that we build internal capabilities, whether that's the ability to manage folks virtually and limits exposure to broader groups of people, whether it's bringing on multiple platforms for testing and testing capabilities, but we're constantly trying to evolve and meet your needs with the most up-to-date information as we receive it. And then there's a real desire to collaborate with all of you to address your pain points. And so we have collectively come up with 3 programs that we would like to make available to our employer partners. The first really is the capacity and ability to screen on a routine basis your employees. Now, we're not going to suggest a single way of doing this, but as Dr. Passaretti identified, as we're thinking about bringing our employees and patients back to our facilities, the one thing that we're doing is we are symptom checking and temperature checking those individuals as they enter our spaces in our workplaces. Doing that on a one-off basis when you have a really large workforce, and we can attest to this because we had lines out the door, without an automated process is often difficult. And so we did build a electronic symptom tracker checker that we would love to make available to all of you. It's reviewed on an ongoing basis by our medical leadership team, including Dr. Casenza and Dr. Passaretti, where we're on a routine basis updating with the latest, greatest information, those symptoms that are known to be tied to COVID. I'm going to say this is not the highest, gooeyest UI interface you've ever seen, but what it will do is allow you as an employer to push out to your employees on a daily basis a checker that will ask them if they have any of the symptoms of COVID. They'll have the capacity and ability to respond. That response will be collected in a centralized location, and we'll either place it somewhere where you can pick it up every day, or we'll push it directly to you. We're working on that and should have the answer tomorrow. This also will provide a link for those people who have underlying symptoms of COVID. It will direct them into our virtual front door to allow them to be screened by a clinician appropriately And if they meet criteria for PCR COVID testing, we'll actually help them get a test scheduled at one of our soon-to-be 9 testing locations across the Atrium footprint. And so a very seamless, thoughtful process that gives you information. Now, it doesn't fix everything, but it's one more safeguard in at least making people think about, do I have cough or shortness of breath? Do I have a headache? Do I have a fever? Before they come to the workplace and potentially expose others. So that will be made available starting tomorrow to all of you. In addition to that, we have a program around management of work-related exposures. With the best hand hygiene and all of the tips that we're going to share with you on managing our workplace environments, there's still a very real possibility that we will have exposures occur in the workplace. We have occupational health professionals who have helped us build a process that upon notification by you, we have the capacity and ability to virtually screen anyone that you believe would be potentially COVID positive, get them through our testing procedure, help you do contact tracing for individuals that may have been interacting with someone in the work environment and potentially exposed. We have a virtual process where we will enroll those people in ongoing and monitoring and screening on a daily basis while they're being quarantined. And if there's an escalation in any symptoms for those individuals that we're following, we can automatically put them through our virtual health process and also get them tested. So we've built all of the behind the scenes ability to manage your work-related exposures and any PCR testing and follow-up care that may be necessary if you have an exposure in the workforce. And finally, beginning later this month, after we complete a validation and pilot site trial on our own employees, we will be making available on-site antibody testing for employers who wish to do this. We have a process similar to one that we use when we do biometric screening. We have individuals that can come on site, consent your employees. This will be done through a venipuncture draw, and then we will provide results back with regards to antibodies through the serological test. Now, that information, as Dr. Passaretti said, is one piece of information in the broader workflow of what people would have to come back. It does not confer immunity. It doesn't even suggest immunity, but it may help you think about how you might split shifts in your workplaces, keep individuals home that might be more immunologically challenged or meet some of the higher end criteria. So we're going to do our best to give you as much information possible as you think about returning to whatever the new normal is in your workplace moving forward. We do have a specific website if you would like more information, if you would like us to reach out to you. If you send an email to COVID-19 RTW, which is return to work at atriumhealth.org, we will have, please provide your name and your contact information. We will have someone reach out to you and then help you get access to and more information about these screening, testing, and managing exposure options that we have for our employer partners. So we're hoping that that will be helpful to all of you as you try to manage your workplaces. I now would like to introduce Dr. Dave Cosenza. Dr. Cosenza is our specialty medical director. He also helps in our employer solutions and has done a great deal of work in our virtual and on-demand telemedicine. And he would like to talk to you today about some safe workplace practices and other operational considerations that you may want to think about as you're thinking about going back to work. So Dr. Cosenza, you want to take over now?
Thank you, Ruth. Good afternoon, everybody. Thank you for attending. You guys are looking at the first slide here. I'll say that what I'm about to talk about next is kind of built on a HR policy that encourages sick patients to stay home, and you'll be hearing more about kind of HR best practices from Ms. Kathy Best. But what you're seeing here are suggestions that you can kind of take to try to minimize exposure, and you also need to have an expectation that at some point you will have a sick COVID patient at your workplace. We already mentioned the screening of employees on arrival. That is both symptom and temperature. Again, definition of a fever is 100.4 or higher. And there are some people that will have no symptoms on arrival and then develop symptoms. Anybody who develops symptoms at work should be quickly segregated, masked if possible, and removed from the work environment. Then you need to have plans for sanitizing their work area and starting to compile a list of people that may have been exposed to that employee. Again, the plan for exposures. If you have any critical employee who is so critical to your operation, you should have plans to start training, a backup plan. The preventing this spread, Dr. Passaretti did a wonderful job of talking about steps you should take, the social distancing, looking at your sanitizing and cleaning practices, looking at your common break areas, and then the last one, protecting your employees. I think that goes back to making sure you educate your employees that if they're sick, please stay home, having a policy that doesn't punish them if they do have to stay home. One of the updates from the last time we did our town hall is the CDC has expanded the list of recognized potential COVID-19 symptoms. Previously, it had been the fever, cough, shortness of breath, kind of what we call the influenza-like illness with a temperature of 100.4. Now you can see it's been expanded to chills, repeated shaking with chills, muscle pain, headache, sore throat, and there's a new loss or taste of smell. The loss of taste or smell is not that common, but it is becoming a clearer indication that somebody may actually need to get tested. So as I was telling you guys earlier, you need to have a plan to try to prevent it, but also a plan for when you have one. Your humans are your best asset, but also your unfortunate greatest liability. So you need to have protocols in place for contact testing following an employee that is found to be positive. The contact tracing, the highest risk are people that were within 6 feet of an infected employee for more than 10 minutes, especially if they're not wearing any kind of appropriate protective equipment or mask. You also need to have a way to track who they were around for 48 hours prior to becoming clinically sick or testing. Then you have to be able to notify their contact that there's been an exposure, monitor those contacts, and then support the quarantine of contacts. The CDC has a great website on how to manage critical employees that have been exposed. The best practice is if somebody has been exposed and they are not critical, that they should be monitored from home and not come into work. For anybody who's considered critical, meaning that they have to be at work, there is a nice pathway that the CDC has developed on how those people should be managed. They should be masked, they should be temperature monitored, and that goes on for the entire 14 days of exposure. Another update I'll tell you that the CDC just made is it has expanded the time frame from the time somebody becomes sick and is positive. The prior time frame was that they could return to work 7 days after onset of illness if they've been fever-free for 3 days and were getting better. They have expanded that to 10 days from onset of symptoms, as long as they're still getting better and they've had no fever for 3 days in a row. This is kind of talking what Dr. Passaretti said. What are the measures you can take at the workplace to prevent spread? Keep patients, keep your employees as physically 6 feet apart when possible. Remote working is still recommended, especially for anybody who's considered a high-risk individual. Making sure that you separate their workstations in areas. Staggering shifts is a strategy that would potentially prevent everybody from getting exposed if there is an exposure, if they're in staggered shifts. The 6 feet distance in common areas, having hand sanitizer, hand hygiene, hand washing is probably the single largest. Dr. Passaretti had mentioned the cloth masks. They are a great recommendation, but recognizing that they are best at preventing somebody who is sick from giving it to somebody else. And then the disinfecting your work environment. You should look at your current cleaning protocols at work and then have a specific protocol for when you have an infected sick employee at work, how to do a deeper cleaning of that employee's immediate area. So Dr. Passaretti had talked on the PPE. For most employers, the cloth mask is essentially will be applicable to most of your employees. Obviously, first responders, higher risk individuals may need more. The mask and with a cloth face covering being sufficient. Gloves, goggles, face shields, and gowns, those again go more to the degree of exposure. What you will see on here is N95s are not recommended for the average individual. And then making sure you determine who needs your PPE. Again, we look at healthcare workers, first responders as kind of being critical front line and having to have a higher level of PPE. And this that's on the list it's not a complete inclusive, but consider accommodations for the vulnerable employees. If you're wondering why what we are now learning about COVID-19 is it hits certain populations much harder than others. Children appear to be doing fairly well. Again, I'll preface it saying that doesn't mean that you won't hear an online or news story about somebody in a low risk population that unfortunately dies. But what we are learning is that this virus hits certain people much harder. If you have one of these, you're much more likely to be admitted, and unfortunately, being admitted also increases your risk of ultimately passing away from this. So if there is a way for these people to do their work remotely or in a place that is more physically distanced with a cloth mask, you should be looking at trying to identify people who are more likely to do poorly if they acquire COVID-19 and how to take an extra step to try to protect them. Next slide, Kim. Yeah, and so I'll turn it over to Ms. Kathy, who's going to give you some advice and best practices on HR policies.
Good afternoon, everyone. Thank you, Dr. Cosenza. So as we're preparing for re-entry, I know that there's a lot of things that you all have either thought about or are continuing to think about. So before organizations, albeit whether you're small or large, prepare to welcome your employees back to the workplace, there are several administrative considerations that leaders should think about for what some are calling the grand reopening, the reentry, the next normal, and in some cases, the next new abnormal. So while we're all being charged with making a lot of decisions in uncharted territory, first and foremost, the safety of your employees and having a safe place for employees to work should be mission critical. So just as we know the state has imposed stay-at-home orders, and now we're starting to experience later this week the lifting of restrictions with a phased approach, as you look at your business operations and you try to determine what do I need to do and how do I need to solve for, I would just ask that you consider before you start to try to determine who needs to return to work and when do they need to return to work, you will want to do an analysis of any temporary or permanent work processes that you may have put in place pre-COVID and during COVID that now require some form of modification, tweaking, or even some cases, deletion. For instance, and here's a couple of points for you to consider. You want to identify what maybe are your short, your medium, and your long-term needs when you're trying to determine the timing and the scope of work that is needed. Some organizations like ours are accomplishing this through committee structures, it may be task force, or even work groups with key stakeholders from operations, maybe finance, labor and productivity, environmental services, information technology. At the end of the day, this is an all hands on deck affair, and there are no silos required. The second point that you may want to consider is really looking at how you might evaluate the physical space and making appropriate changes to ensure that you're also in accordance with these social distancing rules of engagement. And I'll talk a little bit about this more when we address the issues around some of our health and safety protocols. You want to determine what are the critical roles or functions that you absolutely need to have in the workplace. In other words, what are your essential roles and functions that cannot be performed in another location? With so many employees working from home that might need to return to the workplace, determining whether you need to align with your information technology department or other areas to determine how might you shift your remote workers back to the office environment is going to be important. On the other hand, if the role is non-essential, it may make more sense to allow those employees to continue to work remotely. Understanding that there's a conversation that needs also to occur, because there is some debate and some dialogue that it actually may be more costly for your employees to maintain a remote work environment than it is to bring them back into the office or vice versa. So that's part of the analysis from a business operation perspective that you will want to go through. Again, engaging your facilities, your real estate teams in the analysis, while first and foremost keeping safety of your employees and the safety of your workplace as top priority, will help you get there. The other couple of points for consideration is, depending upon your industry and your sector, you may have colleagues that you want to have discussions with in advance. In fact, that there may be some departments that are actually sharing space, perhaps on the same floor, or maybe even the same common areas. So we talk about our non-essential workers for a moment. I think it's really important for leaders to have compassion for those workers who are not deemed mission critical, but they're still very much a part of the workforce. Should these non-essential workers continue to work from home, it will be very important to consider the following. Making sure that you know, more importantly, your individuals. And what I mean by that is, we know that there's going to be some individuals who are very eager to engage, as they may not do well in isolation, and they need that face-to-face contact with their colleagues. Others might need a break from family, from cooking 3 or 4 times a day, from homeschooling, all of those things that now have been really taking over our lives. And they may be eager to return to work, but now they have other responsibilities like a caregiver that did not exist before COVID, making it very challenging for them to do so, but they're still performing at a high level. My point is, not everyone has responded to the crisis in the same way. And while non-essential employees may have a real desire to return to the workplace, we need to make sure that we're demonstrating the empathy and the understanding of what's really going on in their world. Again, the world is very different, and it's up to us to make sure that we're mindful of those changes that have impacted our teams and the individuals on our team, so that we can make the appropriate adjustments. And I think I would be remiss to say, I think also we need to be mindful that we know that there are some leaders who are struggling. We're all human. And some of the leaders who may be struggling may not be equipped to lead effectively. So just like on an airplane, when we hear passengers are told to put on their oxygen mask for helping others, I think the same is true here. So the point is to remember self-care. The next one I want to focus around is developing individual and group communication. I think whatever business decision you make to determine your critical roles and functions, and whether they're essential or non-essential, it's going to be important to set really clear expectations, and again, to seek to understand what are the barriers and the challenges. For the past 2.5 months, COVID-19 has upended work, as we know from a global perspective. Whether it's the stay-at-home orders or workplace changes, restructuring of work, many organizations have had to furlough or lay off employees. The bottom line is that all employees have experienced a significant amount of change. So it's important to ensure you're developing clear and consistent group and individual communications and FAQs, And more importantly, know that it's not a one-size-fits-all. A couple of questions that you may anticipate, and as leaders and as organizations, we need to be prepared to have answers ready for those questions that we assume will come up. A couple of examples might be, what does reentry mean? Does that really impact me? How do I know if my work facility is safe? Will I be required to wear a mask? What if I don't feel comfortable coming back to my facility? I'm not sick, so do I still need to wear a mask? Will visitors be allowed in our facility? How long are we going to work this way? These are just a couple of questions that you can anticipate now and do some brainstorming to really get your arms wrapped around. We know that the questions are going to come up, and more importantly, these are answers that our employees or our organizations are looking to address. So let's start thinking about those now. Taking the time to listen and learn about what the concerns are for a group or for individuals and being able to set those clear expectations is, again, tremendously important. You know, I'm constantly hearing conversations around, well, we're really not working from home. We're really transitioning to more of a at-home working. So collectively, you may want to consider conducting virtual town halls or employee forums and communicating, again, what is the current state, dispelling any myths, updating individuals on what is the organization doing to keep the environment safe and to make sure that our employees are safe when they return to work. Asking very simple questions. How are you feeling? Again, this is not about a speech about tough love, but it's one about I care, we care, and that social support and understanding is what will make great teams even greater through this experience. Individually, you may want to learn about what's changed in their personal lives that has now become a barrier or a challenge to reentry. Recognizing individuals may need or benefit from frequent virtual check-ins, as it just might be that level-headed employee who you think had it all together is now the one that's depressed and stressed and perhaps even on the brink of a breakdown. There was a quote that I came across recently, and it was in Becker's review, and it was advice to colleagues or to leaders that I want to share with you. And specifically, it said, don't stop doing the basic elements of leadership. Don't stop rounding. Keep yourself safe. But don't become distant from your employees. Be intentional in your efforts to connect in meaningful ways other than email. The ability to calm employees in the moment, actively listen, simply the practice of presence has proven invaluable. I thought this was a great quote coming from Greg Harrelson, who's the CEO for Memorial Hermann. I think one of which all of us can live by and learn from. Next slide. So as we think about our health and safety protocols, there's three specific areas I want to focus on. I want to talk specifically about the environment and space, social distancing, and looking at alternative schedules. So before employees re-enter the workplace, evaluating the physical space and making the appropriate changes to ensure that you're in accordance with social distancing, and again, rules of engagement and guidelines are going to be important. Remember, it's all about the safety of your employees and ensuring a safe workplace and addressing the questions and having answers to those questions when they come up. So from an environmental perspective, a couple things that you may want to consider is safe distance floor markers to encourage your employees to stay 6 feet apart. You may want to consider seat spacers for safe distancing in your break rooms, your cafeterias, or even your public seating areas. Now is probably a good time to ask yourself if you should eliminate things like your salad bars, your buffets, or any other self-service food stations in your facilities that perhaps can be replaced with grab-and-go options. Determine if there's other food vendors that perhaps you need to disrupt or altogether do away with that may be coming to your site. It may be some of our local food vendors or even some of our food trucks. These are things to consider. Multi-purpose 6 feet apart stickers are very commonplace, and they can be used on desktops or even the idea of having tabletop safety dividers, especially if you're in an environment where you're set up to where there's individuals that have workstations that are working right next to each other that don't have that partition. Think about counter safety shields. Again, these are both for essential workers or functions that perhaps have to interact with the public. And I think many of us have come across, now that we've been stay at home, if you will, or shelter in place, when you've had to go out, we've come in contact with many of those counter shields just in your local coming and going, whether it's been in the Walmart or whether it's been in the grocery store. As I mentioned earlier, when determining what are the critical roles or functions you absolutely need to have in the workplace, it's going to be very important to think about what are the critical shifts, what are the locations of those shifts. Should we think about maybe staggering some of the shifts? Maybe we have a group of individuals work 3 days in the office, maybe they're 2 days working remotely. Are there essential employees that might need adjustments to their work because there's childcare or elder care needs? Do you have other employees we need to consider who are essential but also have some underlying healthcare concerns or are high risk? Are there other roles in which we can consider that these individuals might perform well in? And the last slide I want to talk about is HR policies and practices. So understanding from an HR perspective that we have been involved in, as I'm sure you also have been involved in as well, understanding there's been a number of revisions to a lot of your existing HR policies and guidelines and the creation of new policies and guidelines that have probably consumed quite a bit of your time during this pandemic. Note that this is an area of focus that will require probably short-term, mid-term, and long-term planning, again, as the landscape continues to change and evolve and as new legislation is enacted. So in planning for reentry, you will want to revisit those policies and practices and FAQs because many of those may be obsolete, or in fact, you may need to modify or tweak or just altogether do away with. Depending upon your industry or your sector, some of you may already have a flexible work arrangement policy or practice in place. This is the idea of remote versus back to workplace. In this case, it allows employees to work either at home or on the road or in various locations for all or part of the week. In some organizations, this may not be an option, and it may not be available to all employees depending upon the role. So for example, in a healthcare setting, you would not expect someone that's in a patient-facing role to work from home, but in essence, you could have someone in the IT space to be able to work remote. So in this new environment, being able to understand and revisit this practice if you currently have in place, and if there are opportunities to expand where currently it doesn't exist. I think traditionally it was commonplace, I think we would all agree, that if you worked in sales or account management, many of those roles required you to be in front of the customer. I think during this pandemic, technology has shown us that you can get married on Zoom, have a watch party, and even watch live concerts all in the comfort of your home. So again, it's that new thinking, that different experience, which brings me to travel and meetings. So while there's still restrictions in place and industries like the airlines have adjusted, as also many others, in modifying their protocols, my recommendation would be to suggest to continue to discouraging business travel and where possible personal travel as a way to minimize the risk and exposure to other employees and or even their family members. And again, as for meetings, we know that technology has really been a huge enabler, whether it's Skype, Microsoft Teams, doing virtual rounding in one-on-one settings, in group settings, all again to minimize the potential for exposure and cross-contamination. Leave policies have been another area for consideration. So whether you look at all of your leave policies, whether it's medical leave, sick leave, personal leave, we know that pre-COVID, you may not have paid employees for time off due to illnesses, and you may have required them to use a bank of PTO. Going forward, you may want to consider paid sick leave for those employees who must be kept in isolation because either A, they tested positive for COVID, or B, they have symptoms of COVID-19 and were in contact with someone who tested positive as well. There may be other qualifiers for isolation based upon the CDC guidelines. And last and final, from an attendance perspective, again, this is an area for most organizations that's very black and white. And attendance is generally coupled with some level or form of progressive disciplinary policy and process. We expect employees to show up for work, and we expect them to be on time. And we expect them to also, bring their A game when they are at work. So given the current environment, and especially for remote employees, we know it's harder to monitor. And I think here what's important is to say is the goal is not to employ aggressive strategies and tactics for transitioning someone out of the organization, but rather consider ways in which you can promote work-life balance differently. For example, consider meaningful projects with deadlines and milestones rather than creating non-value-added tasks that send the message that you're watching the clock to ensure they're getting the work done. Don't get me wrong, I'm not suggesting you can't set clear expectations and have some sense of structure. I'm just simply saying the reality is many employees are also performing other non-work related responsibilities at home. For example, being a caregiver. For essential employees, attendance is probably easier to monitor, but again, you may want to consider modifying your progressive disciplinary practices and really building in more flexible ways to hold them accountable for unforeseeable circumstances. In other words, have the flexibility. Absenteeism may be due to a member that's been diagnosed with COVID. Tardiness may be as a result of other protocols we as an organization have put in place before work, where there's daily temperature checks. There may have been changes to the bus line schedule. There's a number of things going on. So going back to my earlier discussion around having the conversation individually and collectively to really find out what's going on in someone's life can really help to unpack if there are some barriers or challenges. So the bottom line is to first seek to understand, and if there are barriers and challenges, as an organization and as a leader, being able to have empathy and working towards creating and maintaining a safe workplace and ensuring the safety of our employees, most importantly, is mission critical. So thank you for your time. And I know we've said it again and again, and I strongly believe in it, but we all are in this together. Megan, I'll turn it over to you for Q&A.
Great, thanks, Kathy. Appreciate everybody presenting here today, and I'm going to serve as your Q&A moderator. There has been a lot of activity in the chat box, so I appreciate everybody's engagement today. And Dr. Passaretti has been extremely efficient with getting to those questions and answering them. So what I'd like to do is summarize. There are some very specific questions on here, but there's themes that we can pull out. So Dr. Passaretti, I know that you've been answering several questions related to masks, questions about full shields versus other types of masks in different type of work environments. Could you give us some insight into what the recommendations are for masking and how we address some of the questions that have been coming in about masks?
Yeah, so a couple of the questions were related to, in some settings, does it make sense, or would it be appropriate instead of using a either cloth or disposable mask, would a face shield provide sufficient protection? So the point of all of it is really source control and protecting the mucous membrane. So the point of the mask really is if someone's infected, keeping their respiratory droplets from getting out into the environment and infecting someone else. There was an editorial in JAMA that came out maybe last week or the week prior suggesting that potentially face shields that cover the whole face from kind of the forehead down may actually be as effective or more effective than a mask, because it, in addition to covering that mouth area, respiratory droplets coming from there, you also get coverage of the eyes and nose. And then, it's also, you can't, a lot of the problems we worry about with masks is that people play with the mask, they put them under their chin, they don't wear them appropriately. So that face shields may actually provide a little bit of better coverage than the mask, which just cover the mouth. I think both are reasonable from my perspective and probably get at the end goal. In some settings, face shields may be more appropriate, and I think that's totally fine. In some settings, maybe a little bit less feasible. So as long as you're getting the ultimate goal of that source control and protecting the mucous membranes, I think it's a good thing right now.
Thank you. And since I have you, there's a few more themes that we've been seeing. One is about the response to an employee that had tested positive for COVID. Can you just share ideas or guidance around protocols about self-quarantine, as well as cleaning their workspaces and getting them back to work high level for us?
Yeah, so in general, the people that are most at risk for transmission are those that are less than 6 feet for prolonged periods of time. So really close contacts. Brief encounters, much less risky, especially if the individual is masked. So if you are doing kind of contact tracing, those are the individuals that I would focus on, really the closest contacts. You know, there are some questions. It's very hard in this situation, I feel, to give specific guidance because the situations are so variable. But if you come back to these are the people most at risk and work from there, I think that's, you know, what needs to happen in every setting. Once you identify who those close contacts are, you know, if they're deemed to be at risk, so they were within that threshold, nobody was wearing masks, you know, everything, those things ratchet up the risk. Then if they're considered kind of high risk for exposure, the recommendation would be to quarantine. So that means, you know, stay home for 14 days or work remotely or whatever to try to prevent that kind of transmission while those individuals are in the incubation period. There's been a lot of kind of requests for testing for clearance in those individuals. And I just, you know, would point out that that diagnostic test that we talked about is really one single point in time. So doing it the day after exposure really accomplishes nothing because those individuals haven't had time to develop the infection. And then B, even if they're negative, it doesn't mean that during that incubation period, so that period from when they're exposed to when they develop symptoms, that they couldn't later become positive. It really just represents, that diagnostic test just represents a single point in time. So, you know, just be careful about the interpretation of those diagnostic tests in that specific scenario. As far as response, you know, I think good cleaning protocols all the time can only help in whatever setting, you know, rather than being reactive, being proactive for common areas. You know, it's not like someone gets diagnosed and you need to rush into the office and clean their empty office workspace immediately, you know, but it should be done promptly. And then the last component of that is return to work. So the recommendations for return to work are the individual has gone 10 days from either the date of the test if the person doesn't have symptoms or the date of their symptom onset, and that they're at least 72 hours fever-free off of medications and their respiratory symptoms are improving. We do not currently recommend a test-based strategy in most settings to return to work, you know, for those reasons that I mentioned before, that, you know, the type of test that's used for diagnosis can pick up both live and dead virus and can stay positive even after the individual is no longer infectious. So I would stick with, for general business purposes, in most settings, those health department guidelines, which are the 10 days, 72 hours for individuals in the workplace.
Thank you. And there are several more questions, and the team will work to gather these questions and responses up and make sure that we distribute these as well to our audience today to make sure that everybody gets to hear all the information that was exchanged. And with that, I'll turn it back over to Ruth to close us out for today.
Right. So thank you, Megan. Thank you so very much, Drs. Passaretti and Cosenza. And thank you, Kathy, for your wise words and wisdom. For our employer partners, we want to let you know that we will provide a one-page checklist that you can use to help guide your thought process as you're beginning to think about returning to work. It includes a lot of the conversation that we had today. Additionally, it is our plan to have another town hall webinar on Wednesday, May 20th at 3 p.m. So 2 weeks from today, we'll bring you the latest and greatest information and any new changes that have occurred between now and then. And additionally, we'll have some more information about how you might engage with Atrium Health in meeting the needs of your employees as you move forward. I do want to let you know that we're very interested in helping you with symptom tracking and then managing potential exposures and antibody testing in the workplace. If you would like more information or to talk to us one-on-one, please feel free to email covid19rtw@atriumhealth.org, and someone will connect with you as soon as possible. We will send a link to this town hall if you want to go back and listen or share the information with others. So thank you very much for your time today, and we hope that you stay well and that you remain safe. So thank you for your time.